Rotator cuff pain is really no joke. There's one muscle that really gives people a fit with rotator cuff dysfunction. That's going to be the supraspinatus. So the supraspinatus is very avascular. It doesn't have a large blood supply. So that turns into a problem when you're talking about a small strain to the muscle, irritation of the tendon. It doesn't heal as fast as other areas. And so once it becomes inflamed and irritated, it really stays that way. I'm going to show you where it is. So this is going to be a right shoulder right here, right? And this is a shoulder blade, part of the humerus bone. And the supraspinatus, supra means above. This is the spine of the scapula. So you're looking, the person will be looking away from you. This is the right shoulder. And so this is the supraspinatus. And you see where its muscle is here, and that tendon is going to come out here and attach out to the side. Now the supraspinatus is one of 4 rotator cuff muscles, but again, like I said, it's very avascular, and so once it becomes irritated and inflamed, it's very difficult to treat. And so I'm going to show you a few tests I like to do to try to see if the supraspinatus is involved with either tendinitis or tendinopathy, or perhaps you even have a tear. So I'm going to show you those right now. So the first test we're going to do is called the empty can test. And so what I'm going to have Kinsley do, you can do this with both arms at the same time. I like to do it one at a time first. I'm going to go just like this, and her hand is turned downwards, just like she's pouring a can out, that she's emptying a can. And she's going to hold it in this position. I'm going to push down, ask her to resist me, so push up. And what I'm checking for to see if this reproduces pain in the area that she's been having issues with, here where this supraspinatus inserts or over the muscle belly. The next is going to be the full can, so literally the hands like this, like the can will be full before she pours it out. I'm going to push down again, resist, see if she has pain, the same area. If so, it would be positive. The other part of this can be a drop arm test. I can bring her arm out to the side and then let go and see if she's able to hold her arm there. If she's not able to hold her arm there, or she really struggles to hold it there and it kind of goes down slowly, then she could have a full thickness or at least a partial rotator cuff tear in this area. And so now we're going to show you 3 of our favorite exercises to do to strengthen this area to improve the pain and weakness. The first exercise, Kinsley is going to take a light dumbbell. She's going to bring it up in what's called the scaption position. So not straight in front, not straight out to the side, something kind of out here at about 35 to 40 degrees. And she's going to bring that up to about shoulder level and back down. Just nice and slow contractions, somewhere between 8 to 12 repetitions. Maybe she works up to 15 repetitions, just depending on how much weight she can tolerate. And then she would repeat that 2 to 3 sets at least once a day. The next exercise Kinsley is going to do is a dumbbell shoulder abduction movement on her side. And so what she's doing, she's just bringing this up to about 90 degrees, nice and slow, bringing it back down to her hip. And so she would complete somewhere between 8 to 12 repetitions, maybe work her way up to 15, and she would do that for 2 to 3 sets at least once a day. And our third and final exercise is going to be a sideline external rotation movement with a dumbbell. I like to have a towel or something small rolled up under the elbow because it has a higher EMG activity level. And so she's going to do this again somewhere between 8 to 12 repetitions, maybe working her way up to 15 or a combination of the two. And she's going to do that for 2 to 3 sets once a day. I hope that you enjoyed the video, and I hope this helps. It's okay to have pain, so if you do this and you do have some reproduction of your pain, that's perfectly normal in most cases, as long as the pain goes back down after you stop the exercises and stop the activity. Thanks so much for watching, and head over to my website, ChadGOrthoOT.com, where you can follow me on all my social media platforms and also watch all my videos for therapy, rehab, and sports medicine. Thanks so much.